Hi, my name is Kelsey. I'm a physical therapy student at Campbell University, and today we're going to be talking about tibiofemoral distraction. So according to Dutton, as the knee moves into slight flexion, you're going to get some distraction force of the tibia on the femur. And so this technique could help improve some knee flexion. It's not a direct way to improve the knee flexion, according to Dutton, but it's just a way that could kind of aid in that. It can also help improve general mobility of the knee as well as relieve pain. So in order to perform this technique, I did a literature review search, and there wasn't a whole lot of evidence about which technique is better than other techniques. There is a simple method of just sitting here, grabbing on to the leg that's supported on the table, and then just providing a downward force. As you can see, my body mechanics aren't the best in that position. I also don't have the mechanical advantage. So another way to do this technique would be to use a weighted cuff around the ankle, and then you can slip your foot through it and provide a downward traction force that way. We don't have that available to us, so I'm going to use a gait belt, and I've kind of makeshifted it into a way that I can use it. So I'm going to do a simple figure 8 knot that we've all learned, and then slip the patient's foot inside of it, and so that it crisscrosses right around the ankle. And then I can slip my foot into the bottom of it, and then I can simply just provide a downward force with my leg to provide the distraction on the tibia on the femur. So you can do different grades. For this one, I'm going to do more of a grade 2, so I'm going to go towards resistance and then just kind of provide just a sustained distraction. And this would be for pain relief and to improve mobility as much as we possibly can. It's not, again, it was not a direct method to improve knee flexion, but it can aid in some of that according to Dutton. So now I'm going to perform this technique on my patient and speak to her in layman's terms. So Cam, I hear you're having some pain at your knee, and so what I'm going to do is provide what's called a distraction technique. And it's just kind of, you're going to feel a nice pull down your leg, and it's going to help relieve some of that pain that you're having, and maybe improve a little bit of the tightness that you feel. Okay? So you shouldn't have any pain with this. It should actually feel kind of good. Okay, all right? So just let me know if you do have pain, and I can back off. All right, so you can slip your foot through here. My foot through here too. And again, you're just going to feel a nice pull through here, so just let me know if it's too much. Feel okay? Mm-hmm. Right. And so again, I can perform this as long as I feel like I need to get the changes that I wanted and the pain relief that I wanted in my patient, and then I would just reassess and I would say, so on a scale of 0 to 10, how's your pain now? It's about a 1. So the pain decreased with my technique.